on the transmission and surveillance that has been put up in the place in the surge of the HMPV virus in India. It's time to also get my guest on the broadcast, Dr. Raman Gangekar, who is a former head of epidemiology and communicable diseases of ICMR, is joining me live on the broadcast. Appreciate you joining me live on the broadcast. So thank you for giving us your time. In the view of this transmission and the discussion that we are taking up, given the kind of cases that are coming at this point of time, do you think the reporting of cases in China is just a usual surge that happens in winters every year? But in India, it is also being viewed as a more urgent and more severe scenario.
Absolutely. If you actually look at it, is the only country where they had actually undertaken a survey and they found that their prevalence rates, or you may call even incidence, new infection rates, they tend to be around 4% across the nation, China. Now, given that fact, are they reporting more cases? Perhaps not. No, they have also said that we are seeing a decline in cases. One must also remember that this is a time when winter is almost there to go. No? So there is a decline which they are seeing, and 4% of incidence, if you call it as incidence, because this is a short-lived infection, is seen across in the world. Every country has this particular virus in winter season. Their prevalence rate may be just close to about 4%, which also includes India.
Doctor, so how do we understand the clarity on the virus being old or new? Is the HMPV an existing virus, or is there a new variant that has mutated leading up to this in fact transmission getting more stronger as well?
So far, we have no information on the sequences that this HMPV virus has in China. There are different strains of this particular virus. However, in absence of any information, what is most important to remember is if it has not caused any kind of change in morbidity pattern or death rates, that is mortality rates, we need not worry, because it's a virus which tends to mutate, and unless it impacts the natural history, what proportion of people, if they acquire this infection, how long would they be perhaps requiring admission in the hospitals? Has it changed? We have no idea. So far in India also it has not changed. Now, what proportion of people would die after getting this infection? That is unknown across globally. Because this is a mild infection. But if it uh, starts killing people, in those circumstances, there is a reason to worry. But as of now, those genetic sequences of China are not available. So I cannot comment on that, whether the virus is different.
So, how do we make the understanding of who are the vulnerable groups? To put it precisely, who is at most for the risk of getting infected with the HMPV, and who are the groups that need to be protected at first and are the most sensitive when the transmission is happening?
HMPV will be there, anybody will get it. It's a common cold kind of a virus, but it is more likely to be severe among those who are under 5, those who are above the age of 65, those who are immunocompromised, like those who have HIV infection, those who have cancers. They are more likely to get it as severe infection. And what do we mean by severe infection? They may get pneumonia at its worst. Would these patients die due to this particular virus? There are no reports to suggest that the persons will succumb to this particular illness as of now. Now, if this is the case, if it is not affecting others, what does it indicate? It indicates, there is one good paper that has come from the West. What they have found is the first episode of this infection tends to be severe. It's a common infection, so it spreads across. And only among those who are under 5 and over 65, you find that they may create some kind of a severe infection. And after that, all of us continue to be vulnerable to this particular infection. And in each recurrent infection, you will find the severity of the disease goes down. So most of us may have acquired this infection more often than what we understand. These infections that we get from childhood actually have partial protection against severity. It's almost like a natural vaccine that tends to occur, that tends to be given with each infection. So I don't see it as a major issue.
In that view, sir, then how do we understand that why are the infants testing positive for HMPV? Recently, also the cases that have emerged and that have also been confirmed from the center have the larger number of infants, specifically under the age of 2, being impacted and testing positive for HMPV. Does this mean that they need to be, in fact, at this point of time, given the utmost critical care so that there are no transmissions happening and eventually there are no serious cases that emerge out of the test that turns positive?
No, that is because this is winter season. There would be many cases that would be occurring in adults and we don't test them. If you actually look at National Institute of Virology's data that they had collected between 2016 to 2018, and they tested it for different respiratory viruses, and in the population that came with common cold-like symptoms which don't require admission, which we technically call as acute respiratory infection or ARI. Those who get admitted because of acute respiratory infection, we call them as SARI, that is severe acute respiratory infection. And what did they find? That among those who had ARI, that is a milder kind of symptoms for which people tend to attend outpatient clinics, the prevalence for instead of prevalence, I would say that the proportion of people who got this infection of HMPV was close to about 3.4%. And those who were admitted in the hospital because of these particular symptoms of severe respiratory infection, it was found to be close to 2.4%, which essentially also means that there is very little increase in severity, if at all, or the severity of this infection, severity of the disease is likely to be low even among those who are admitted in the hospital. So it could be seen among anybody. Just don't think about it.
All right. So, how do we understand that what is the right time that one should get tested themselves for HMPV? And if they do decide to get the test done, what are the also precautions that one needs to take up in the mind after they turn positive or the test turns positive?
If you ask me, only those who are sick and admitted in the hospital due to unexplained, because you would always test them for influenza, you may test them for any other pneumonia related causes. If they turn out to be negative, perhaps you have some room to say that I would like to test for HMPV, which is a self-limiting infection. I would not recommend routine testing for anybody who has a common cold, because I think that is absolutely redundant. You don't need to do.
All right, so that's one big understanding that we are receiving, that routine testing is redundant and it should not be practiced at large. But what is the answer on how long does the HMPV test result take? There is a lot of information, fear that's ongoing on that matter, how different it would be, and if at all it is going to be different, how differently it needs to be dealt with.
This is RT-PCR, so you would get it on the next day, or otherwise you can do a panel testing for respiratory viruses. I would not talk about names of those tests which are available commercially because it is unethical on my part. But there are different panels that are also associated, that are also seen in the market. But as I said, no routine testing, no testing for anybody who has cough and cold. Just trust this part. Trust that winter is ending as of now. You don't need.
And what about for the circumstances in which a person or an infected person should be having the understanding of quarantine? Because it has been practiced earlier, and that is why when the transmission happens, and to isolate the transmission, what are the circumstances in which one infected person need to quarantine themselves? Is it the similar way in which COVID-19 quarantine guidelines were there? The center also had issued some of the guidelines, particularly for the isolation of 7 to 14 days.
Not quarantine at all. No, what is required is, this is a mild infection. All of us are bound to get it at one age or the other. What is important is, if I am found to be sick as an adult, if I have common cold like symptoms, and I have a child which is less than 5 years old, or parents who are more than 65 years of age, I must follow all COVID-related precautions that we talked about. If the child is found to be having common cold-like symptom, please don't send that child to the school, because whether it is HMPV, whether it is influenza, the child is going to spread that infection to his friends when they stay together. If we follow these two precautions, that should be.
On that note, doctor, my last question is in fact the most essential one, also for the public to understand and for the people who are looking up to get the verified information from the concerned medical experts, being equipped with the understanding of what it is likely. What can one do to prevent the spread, the transmission of this HMPV virus? What are the preliminary steps that one should take and practice at large, so that they can be protected in a large capacity as well, and they remain unaffected for the longest time possible that the virus is spreading?
Well, same as we talked about. No? If somebody who is infected, whether known to be infected with HMPV or perhaps any other viral infection, it is good to think that you should not mix with people without ensuring that the precautions are followed. And to me, what is most important, which we are trying to propagate all the time, even in COVID, that if your child is sick, if the child has common cold, if you send that child to the school, you are bound to spread the infection. If you follow these two precautions, the incidence of these infections will go down.
All right, on that note, Dr. Raman, thank you very much for speaking to us and giving us your time, particularly in fact, breaking it down for the benefit of our viewers on how to deal with the transmission and the spread of something as serious as HMPV, how serious it is, and how to, in fact, understand the severity of the matter. Now it's time to shift our focus. Nimisha Priya, 37